Well, Health Plan of Nevada's mission is not only to help people live healthier lives, but to help make the health system work better for everyone. Mike Davis took a trip to Health Plan of Nevada to learn more about the impact of social determinants in our community.
Hey guys, we're here at Health Plan of Nevada discussing how social determinants impact our community, and that's why we're here with Liz Maya and Guy Girardin. So Guy, let me first start with you. You're with Puentes. Can you tell us about your mission and all the work you do in our community?
Yeah, so Puentes began as a nexus where we were trying to develop collaborative relationships with different organizations in the community to improve the effectiveness with which services were being delivered. We've evolved quite a lot from that into the development of culturally relativistic, comprehensive, and sustainable solutions to deal with some of those issues in marginalized communities.
Okay, and can you better explain for everybody at home what social determinants actually means?
So social determinants are really the underlying causes for what creates the inequities and disparities in marginalized communities.
And now Liz, here at Health Plan of Nevada, how do you guys combat social determinants and work with your members on just combating that issue?
Well, Health Plan of Nevada uses the social determinants of health to determine what programs and services we provide for our members. And when it comes to our impact on the community, we also partner with organizations like Puentes to get out there and address those social determinants of health.
Guy, let's go back to you. How do you think, or why do you think, social determinants arise?
I think the biggest issue that we see in the communities is there's really a lack of cultural sensitivity in the delivery of services to marginalized communities. For example, we find that there's just a general absence of services in a lot of marginalized communities where people aren't able to access the programs and services that they need. The other thing that happens a lot is that we see that in the development of programs, cultural sensitivity really isn't taken into consideration. So what happens is you have organizations that have, incredible infrastructure, and they're really great organizations, but they don't really have that component in their organizations. So people that need those types of services aren't being serviced.
If social determinants, if these are the issues that people at home feel is impacting them or their families, where can they go for more information?
Well, if you would like to learn about what's happening here in your state in Nevada, you can go to americashealthrankings.org. And if you would like to learn about Health Plan of Nevada's services, you can go to myhpnmedicaid.com.
All right, and anything from you, Guy? Any other resources?
Yeah, Nevada Minority Health and Equity Coalition, UNLV School of Public Health, the federally qualified healthcare centers that are dispersed throughout the community are great sources of information as well.
Okay. Thank you guys for everything you're doing for the community and for all this great information. And I'll toss it back to you guys in the studio.
All right, Mike, thank you. If you're a member of Health Plan of Nevada's Medicaid plan and want to learn more, visit myhpnmedicaid.com or call member services at 1-800-962-8074.